Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
Anita says, "Hi, doctor. I'm Anita, and they are a speech and language pathologist, special ed. How can I help a 3.5-year-old to ask for help for the washroom in the classroom because the student soils often during the activity? So how would you teach them to ask for help?"
So it's interesting because when I read the question, how do I teach someone to ask for help? In my mind, it's an immediate different path than asking to go to the bathroom. To me, there's two paths, and I'll explain a little bit more. Asking to go to the bathroom, I would start with a schedule. This child needs to be on a schedule and therefore taken to the bathroom on a schedule. And you have to identify the baseline of the schedule because you have to time and write a diary on when they soil themselves. It's either after a certain meal, after a certain period of time, after a certain activity, whatever it might be. But once you have done that for a few days, you'll be able to identify a baseline, which essentially means, oh, they need to go every hour, every 2 hours, every 30 minutes, every 15 minutes. It depends on the child and the age and the time of day and all of that sort of stuff. Once you've established that, I would start to take the child to the washroom on that schedule at the baseline. But before going, you will have the child say bathroom. Just have them imitate bathroom or some word that is appropriate. Washroom. Oh, did they say washroom? Canadian.
Yes.
I love that. I know that because my husband is Canadian.
Oh, funny.
So, so you will basically then say washroom, and then you will take the child. And now you will gradually try, very, very slowly, try to increase that period of time. So if it's 15 minutes, you'll try for 20. You want to go slowly because if the child has an accident, you need to back up again, right? And over time, as you get close to the child and it's that time to go, you just go like this. You could prompt it with a visual. We actually have, a lot of times what we do is we'll have a sign on the child's table, and we'll point to it, the child will say washroom, and then you'll go. And gradually the child will realize that saying washroom precedes going, and then they will void, and then you will really reward it, because that's very important too, is that when they go to the bathroom, you reward it heavily, right? And you keep them on a schedule like that. Now, asking for help, I would teach a little bit differently. I would actually, the way that we start that, because you can ask for help for a multitude of things, right? And so one of the ways that we start that is to have like a jar that is very, very difficult to open, like a pill box that is childproof. And you have things in there that the child wants. For instance, there are big jars that are meant for this, and the child can't open it, and then you will sit with the child and prompt them to give it to you and say, help. And then you will open it for the child, and then the child realizes, whoa, this is a very powerful word. When I say help, they come to my rescue. They give me this item that I wanted. There's so many other things that a child might need help for. For instance, an object that is out of reach, or there's so many different things. And then that label of help will be something that you can prompt the child to say every time for those different scenarios, but there's going to be a lot of them. And also remember, you can always use visual stimuli, like for instance, a board that has the word help on it, right? I mean, using a picture exchange system is very helpful when you have words that have multiple use, like help.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.